Hello, I'm Dr. Steve Carstensen, Editor-in-Chief of Dental Sleep Practice Magazine, a MedMark publication. Welcome to a live presentation and Q&A with Dr. Mayer Patel and CEO of Easy Sleep, Keith Woods. In our webinar today, we'll be learning how to obtain better patient case acceptance and appliance efficacy outcomes. We'll learn tips, techniques, and step-by-step instructions for when and how to fit the myTAP trial appliances in your practice. Also, we'll learn how to utilizing Easy Sleep's Love at First Bite patient efficacy program can increase your custom appliance deliveries. Make sure you stick around at the end of this presentation for a special offer from Easy Sleep. Before we get started, I'd like to invite viewers to use the question box in your control panel to ask any questions. Your questions will be answered at the end of the presentation. I'm pleased to introduce one of our guests for today and a good friend, Dr. Mayer Patel. Dr. Patel has, for the past 14 years, run his dental practice dedicated solely to dental sleep medicine and craniofacial pain in Atlanta, Georgia, and is internationally renowned lecturer in these areas. He educates thousands of dentists every year, team members included, to help them better understand the treatment of these conditions within their own dental practice. Our other guest for today is Keith Woods, Easy Sleep co-founder and CEO since 2012. He's a healthcare entrepreneur. He's founded and co-founded several sleep and dental sleep medicine companies focused on disruptive technology and high-level services. Welcome, Dr. Patel and Keith.
Thank you very much. So, without any further delays, I'm going to go ahead and start discussing the myTAP. And I want to thank Steve Carstensen and everybody else at the organization that actually is facilitating and assisting with having this presentation be successful. So a little bit about myself. As Steve pointed out, I am a sole owner of Craniofacial Pain and Dental Sleep Center of Georgia. I do enjoy teaching. I do enjoy providing as much assistantship, mentorship, or whatever it takes to help you succeed in your practice as well. We're going to spend some time today talking about the myTAP. The thing with the myTAP that you'll realize at the end of this presentation that there's many applications that you could probably utilize it if you've not already been using the device itself. Now, for starters, when we start off by opening up the myTAP, what you'll find inside the packaging is a couple of items. Going in a clockwise manner, you'll find an instruction sheet as well as a amber-looking horseshoe positioner that we will talk about molding at the end of this presentation. You also have a patient fitting instruction sheet that's very clearly outlined as far as how to go about fitting and getting the devices fitted for your patients. And this video that we are going to discuss will actually go into that in much, much more detail. You'll have the appliance case, and you also will have one set of a myTAP device. Now, a couple things about the myTAP I want you to be aware of. First of all, it should be used in adults only. It should not be used in individuals that are actively getting dental treatment done or those that already have braces on or are going through orthodontic treatment of some form. Do not use it if you have any removable dentures or bridges. Do not use it if you have any temporary crowns, as it may dislodge it. Do not use it if you have any loose teeth, loose crowns, or loose fillings. Basically, any poor restorations, it is definitely contraindicated. If you need to have at least 8 natural teeth in each arch, and you had to have at least seen your dentist in the past 12 months to make sure your gums and teeth are healthy prior to fitting a trial device. Now, when you take the device out, it'll basically be assembled as shown in the picture above. And the idea here is to take the advancement screw out and separate the two components. The way you identify which is which arch, the picture in the lower left is for the upper arch, which is this little clear plastic sleeve that protrudes in the front aspect. And the picture on the right is for the lower arch, and what kind of gives that away is that little protrusion shaft-like where the advancement screw actually spins on. Now, it is recommended to use hot water, preferably boiling water. Tap water not always is appropriate when trying to get the myTAP to soften for you to be able to fit them with your patients. So if you can get some nice hot boiling water, preferably from a kettle, or microwave a cup with some hot water, it's a good starting point. And the idea here is to submerge the upper tray first into the hot water, and the tray will go from an opaque to a translucent color, as you can see here, where it's actually clearly softened up, ready for adaptation to take place. When you take this to the mouth, you want to be cautious, especially on the buccal aspects. You don't want to catch the buccal wall of the upper tray up against the cheek or the tooth. It'll have a tendency of rolling it in and possibly losing some retention. That protruding component that you see in the front, you want to also be in a position where you line that up with the nose. You want to use the patient's nose as a point of reference when you're lining up the upper as well as the lower. Now, once you put the upper tray in, have the patient gently bite into it. Have them push the tongue up against the roof of their mouth and pucker their cheeks up against the device for about a minute. After about a minute of letting the tray sit in the patient's mouth, you want to take your fingers and basically adapt the buccal walls, both on the right and the left, and just take some passive pressure and just push up against the tray itself and up against into the tooth itself. I would encourage you that when you do this technique, do hold or brace the patient's head on the opposite side. All right, and the intention here is to try and get better adaptation for better retention. Once the tray comes back to an opaque color, go ahead and just gently remove it from the upper arch and then let it sit on the table for it to completely set. It may take an additional 5 more minutes to completely set the tray itself. As you can see, once it has molded and it has actually changed back to this color, it's ready for you to go ahead and proceed with the second tray. But prior to doing that, I just want to review the key steps once again. One point of interest is the upper tray can be adapted to smaller arch widths and larger arch widths. What I encourage you to do is try the tray in first prior to submitting it into hot water, and this will give you an idea whether you need to expand it or shrink it when it's time for you to bring it into the patient's mouth so it fits the patient's arch form. Submerge the tray in boiling water for about a minute, as mentioned. Remove the tray with some prongs because it is kind of hot as far as the water is concerned, but do shake off the excess water and wait about 20 seconds before you take the tray into the patient's mouth. This way, limiting any burning or any irritation to the patient's gums and cheeks. You want to place that tray, as shown in the video previously, up against the upper teeth, but make sure that that center protruding element aligns with the nose. So what I encourage you to do is walk the tray in prior to seating it completely, get the alignment addressed, and then passively engage the occlusal aspect over the upper arch. Instruct the patient to gently bite down into it so they can just brace it and support it, along with having them pucker up with their cheeks and pushing their tongue up against the roof of the mouth just to help with some adaptation period. After about a minute, take your finger, run it up against the buccal aspects to once again try and get better adaptation. What this will basically allow you to do is get some good retention, and then allow the tray to sit probably for another 2 to 3 minutes before you remove it from the patient's mouth. Now, to speed this process up, what you could also use is air-water syringe, just blow some air on the tray itself, or you can have the patient just sip some cold water and hold that cold water for a moment in time, just to kind of speed up the setup process. To remove it, be a little bit gentle. Place your fingers on the top edge, slightly towards the molars, and basically with some downward force, go in and remove the upper tray. And once removing the upper tray, just place it on the counter or put it back in the little case that it comes with so they can further cool and further set up. What we want to do then is go ahead and fit the lower tray. Same rules with the lower tray. You want to basically go ahead and submerge it in hot boiling water. As you can see, what differentiates one from the other is that shaft that actually sticks out. That is for the lower component. Once setting it in hot water, you have this clear appearance of the tray. Wait about 20 seconds and then take this into the patient's mouth. Now be careful with the lower tray. The problem with the lower tray is the tongue. What you're going to find is the lingual wall of the lower component has a tendency of rolling in or folding in if the tongue happens to catch it first. So one little gesture is when you take this to the patient's mouth, and there again, being appreciative of that little shaft that you're holding that is actually going to center itself on the upper nose, slightly have the patient raise their tongue up as you seat the tray. And as they raise the tongue up, and it allows you to seat the tray, have them bring the tongue back down over it. And the idea is to prevent the lingual roll of the tray itself. Once again, have the patient bite into it, puck up against it, and then after about a minute, you want to take your fingers and basically go ahead and adapt the buccal walls. The idea, once again, is to get better retention, and as shown in this video, do support the head on the opposite side as you're adapting the buccal walls. All right, keep in mind that you want to basically keep that tray in there until it actually changes to an opaque color before you start removing it. Because if it's still the translucent color, you're going to distort it as you remove it. Once you remove it, once again, set it on the tray and let it go to complete set, which takes another 5 minutes or so. You'll find that the actual adaptation period of fabricating these trays would continue to set up over a 24-hour period of time. And it's not uncommon to possibly have patients complain about some tightness at their first follow-up, or probably you get a call stating that they need to come in and get the tray slightly adjusted, and we'll give you some pearls on how you can rectify those issues. So to quickly just review the lower tray, same rules as prior, submerge it for about a minute in boiling water, remove the tray, wait about 20 seconds, do definitely shake off any excessive water that might be on the tray. When centering this tray, be cautious as far as making sure that the advancement rod lines up with the nose, which is the same reference you used for the previous tray. But in this instance, have the patient raise their tongue up as you gently seat the tray onto the lower arch. Once you've got it in place, have them set the tongue back down over the appliance itself, have them bite down into it, and then passively have them close their lips up against it, pucker up against the tray itself, use their tongue to adapt the lingual walls by just thrusting it up against the device itself, and then go back in and adapt it with your finger as shown previously. And the idea is here purely for retention's sake. Let it sit for about another 3 minutes, or you can speed it up with blowing air or have them hold some cold water in their mouth, and then gently remove the tray and then let it sit on the countertop to completely set even further. Now, once that's been accomplished and you've got the trays that have set for a period of time, it's a matter of assembling the upper and lower components together. Take the two occlusal surfaces, the flat surfaces, lean them up against each other, and take the little shaft into the upper sleeve. And once you've done that, go ahead and attach the advancement screw. And I would encourage you just to put the advancement screw on the tip end of the rod itself. You don't need to drive it down entirely into the shaft yet. But by at least getting it adapted, you don't get the upper tray and lower tray separating. And this way, there's a movement that is still available. When you set this back in the patient's mouth, they'll basically adapt themselves into by biting into the tray itself. And what you're going to find by doing so, their jaw will stay probably in a more centric occlusion type of an orientation. Now, when they close into the tray, I will go ahead and advance that screw so that it goes up to the upper shaft, which is kind of where the centric occlusion is. And then by having them protrude, you can take a look at the shaft and get a sense of how much protrusion your patient can achieve. Many times, I'll probably just estimate what that distance is and turn that screw about halfway down, which means you basically protruded the device by about 50%. Okay, and do remember that this, at this point, is just a relative starting point. You know, further advancements can be done by turning that screw in a clockwise manner. And your patients can also judge how much they really need by actually wearing it, getting some positive feedback, and then making the decision whether further advancement is necessary or not. Okay, removing the device from a patient's perspective, we went over what we need to do to remove it. Once this thing has completely adapted, it basically has some decent retention. So what I encourage the patients to do is to put their thumbs on the lower arch, push up, and as they push up, open their lower jaw. And for the upper, get their fingers as far back as they can, pull one side down to loosen it up, and then follow through on the opposite side to completely disengage it. Again, you'll find that when this device has been worn for a period of time, retention is a very good thing, and it does get tighter over a 24-hour period of time. Now, you will run into scenarios or situations where possibly the trays are too tight and the patient is having discomfort with it. A simple way to resolve that is, instead of putting it back into hot boiling water, just run the tray under hot water, insert the tray back in the patient's mouth, and briefly just move it from side to side. And what you're trying to do here is get a little bit of expansion into the trays. This way it's not as retentive. Conversely, if it's too loose, what you may need to do is repeat the entire fitting process again. Take the tray, put it back in some hot boiling water, set it back in the mouth, have them bite down, have them push up against with their cheeks and their tongue. And then when you adapt, just be a little bit more aggressive with the amount of pressure you apply with your fingers to get the buccal wall to adapt to the tray. And that, for the most part, will basically help with getting a better adaptation of the appliance. When we talk about pointers, the big mistakes that a lot of people make is this aspect right here, where they fit the upper, but they don't use the nose as a reference point. They fit the lower, they don't use the nose as a reference point, and then they decide to assemble the two trays together, and you notice that the shaft and the upper rod don't fit, or they don't approximate. Now, you can be off by a little bit. This is not hardcore science where you have to draw a midline or draw a line on the patient to be accurate. If you're off by a couple millimeters to the right or left, that lower shaft has flexibility in it. It's not going to be that critical. The scenario is when there's a drastic, like you can see right here, where you can't even approximate the two pieces comfortably without the patient having to shift their jaw in one direction for them to engage. In this situation right here, what you need to do is basically start off by recentering the trays. And to do that, you go through the entire process of putting the trays back in some hot boiling water. The good thing about these trays is when you put them back in water, they come back to the original shape. So even if they've been molded and have been adapted, they will actually come back to what you originally had seen when it actually is removed from the hot water. So it just requires you to remove it, recenter it, be cautious about recentering, readapt the trays, and once the readaptation period has completed, then go ahead and assemble it. Now, because it's a device that's going to move the jaw forward, even though it's a temporary device, there are some side effects that you need to be well aware of, and some side effects that you really need to educate your patients on, and a few things that you need to do, a few things you need to take into consideration to try and minimize some of these side effects. The one that you might find, and there again, this is typically a day or two or three later, is there'll be some slight gingival irritation or some discomfort associated with it due to the pressure. One quick fix is you just take that area, basically run in the hot water, take your thumb and slightly bend it away. Or you can take a little wheel and just buff out the area that the gingival irritation has been pointed out by your patient. Excessive salivation is pretty much just a body's reflex to thinking that there's food in the mouth, and for the first day, maybe two, in some cases 3 or 4, the patient may salivate excessively when the device is in the mouth. A simple fix really to that is to just put a face cloth over the pillow, and typically after a few days of wearing it, they will desensitize. Another little tidbit could be that they wear the device 15 to 20 minutes before they retire for the evening, so they can kind of get the majority of the salivation process done with, so that when they're sleeping, it's not a major concern. And in a few instances where they just are so well hydrated that salivation is still an ongoing issue, I may suggest they take a Benadryl for the first few nights just to dry them up so they can acclimate and adapt to wearing the device. Slight jaw soreness or tightness might be present initially, but with adjustments, it does get better. This is where you really need to screen your patients prior to fitting them to make sure that their temporomandibular joint and the muscles of mastication, as well as the supporting muscles, are healthy prior to putting a device in the mouth and trying to draw the jaw forward. There is a slight temporary bite change that does happen, not just with trial devices, but also with custom devices. This is where instructions need to be provided where the patient is instructed to bring the bite back the next morning. I will show you a little video on making a little AM aligner to assist with that process to try and minimize this temporary bite change from actually occurring. Movement of teeth is possible, like with anything else. There again, this is a trial device, not something that they'll be wearing for a very long period of time. You're wearing for probably a good number of weeks to maybe a few months, but no more than that. So from that standpoint, it's not a major concern. But from a periodontal poor health standpoint, wearing a device that brings the mandible forward, the forces placed in the teeth as a result of holding the jaw forward could possibly cause some movement of teeth, which you need to make your patients aware of. Pain in the jaw joint, once again, either due to the fact that they had a pre-existing problem that was not identified, or possibly that the advancement was beyond their adapted range, caused them to have some jaw pain. Another thing of caution is to just be aware that the jaw is now being pulled more to the right or the left because of poor alignment of the upper shaft and the lower shaft to the nose, where you've decided to just reassemble the device, place it in the patient's mouth, but as a result of the two shafts not being lined up during fabrication, you'll find that the jaw will be pushed to one side. Typically, the side that the jaw is pushed to is the side that the jaw may be tender or may have some, patient may have some complaints of pain in. So just be aware of some of these things when it comes to jaw pain. The permanent bite change will definitely happen if they don't do the morning activities or morning exercises to reestablish the bite. So you want to make that extremely clear to your patients. Now, what you're going to fabricate them is this AM aligner that is in the package when you open it as part of the kit. Here's an example of taking that horseshoe and cutting it up into a third. And basically what you do is place in some hot water, it softens up, adapt it to the upper teeth, have the patient bite into centric occlusion. And what you're just basically doing is kind of indexing the upper and lower bite. And by indexing it, it also gives them a point of reference of where to place the lower jaw in the morning so that they can bite up against this AM aligner to reestablish their normal bite. And the idea here is to definitely minimize the bite change that can actually occur. Once you've adapted it to the mouth, I'll run some cold water, place it back in the mouth so it's nice and solid and set. You can use a full arch, or in this case, you can use a partial arch. There's no right way or wrong way. It's whatever works best in your hand. But what you'll see happens is the posterior teeth are in occlusion. The anterior teeth are in occlusion with the understanding that you've got this AM aligner that is accompanying some space as a point of reference. And the instructions will be basically remove the myTAP appliance, place the AM aligner in, set your lower jaw into it, bite down as hard as you can, sustain that for about 20 seconds, and then open your mouth and then repeat that again, and then repeat that again one more time. And with 3 good attempts, majority of the time, the bite's back. If it's not, have them repeat that for another set of 3, and if they're still having difficulties with it, have them discontinue the device and contact your office so you can troubleshoot for them. So some examples where really a myTAP has a good foothold is a situation where you'll have a patient that may query a question and ask you, well, how do I know that the custom mouthpiece is going to work for me or is going to help me with my snoring, before I invest in a custom device? And this will be a time where you may want to consider having the patient go home with a trial device. And what you're basically asking for is there a change as far as how you feel? And is your bed partner happy that you're not actually snoring? So this will be another way to kind of get patients to get an understanding prior to committing to treatment. Another more common situation that we are faced with is when you have a patient that already has a custom device that happens to be broken for whatever reason, and it needs to be sent back into the laboratory for repairs. Most of these patients are not happy to go home without anything, especially for the fact that they want something and it's been beneficial for them. So this may be another example of fitting them with a myTAP device as a temporary device while the device is being repaired. Or you may have a situation where they've got some dental work that needs to be done, and you want to wait till the dental work is completed prior to making a custom device. Now, take it for granted, earlier I did mention that if they have active dental work, it's contraindicated, and I also made a comment if they have temporary crowns, it's contraindicated. However, you can be creative when it comes to this. If there's a lot of restorative work, such as crown and bridge, then I would discourage you from using it. But if it's basically fillings and things of that sort that you need to get the teeth healthy prior to fitting them with the device, then maybe consider a myTAP. Do you understand? They've been diagnosed with a problem. They've come to you for a solution. You don't want to drag this out any more than you need to get their dental health in health and then transform them into some form of active therapy. In that period of time, I don't see any reason why you should not offer a temporary device. So at least you can get their medically diagnosed apnea somewhat managed while you're getting the dental work completed. It's always wise to have myTAPs on the shelf. Here's an example of my storage closet. As you can see, there's my forks, my impression material, but we always have a number of kits available because you'll never know when you need to pull a kit to fit a patient with it. So always have some inventory on hand for you to be able to do this chairside fitting. Funny enough, but one time that really a myTAP can be of significant benefit is when you fit it on a patient, and I actually tell the patient that the bed partner can help titrate the device and find that position that's going to work best for them. And here's an example of a patient wearing a myTAP and the bed partner just reaching over because the patient is maybe gasping or maybe snoring or heavy breathing, and you just gently dial that screw 1 or 2 turns, and you do that on a nightly basis. So while the patient's actually sleeping, the bed partner, if they're awake or if they are woken up because of their bed mate, can help titrate the device for them. So there's one other advantage with the myTAP because of the fact that the advancement mechanism sticks beyond the lips. It's easy for a bed partner to assist in that process. So with that, I'm actually going to pass this over to Keith.
Thank you, Dr. Patel, for the great presentation on myTAP. Again, I'm Keith Woods. I'm the CEO of Easy Sleep. We've been offering home sleep testing to dentists all across the U.S. since 2012. Some might be asking, why is a home sleep testing company partnering with a temporary appliance product? Well, the reason is case acceptance. In our experience, and what we hear from dentists every day is the same two questions come up, same two challenges, if you will, come up when it comes to presenting to their patients for custom oral appliance therapy. And those two questions are simple. It's how much is it going to cost for me to get custom oral appliance therapy, and how do I know it's going to work? And we created this Love at First Bite patient efficacy program to address those two questions. How much is it going to cost, and how do I know it's going to work? With our patient efficacy program, I'll go over just real quickly some features and benefits. First of all, you get a chance to offer your patients the Love at First Bite offer. Love at First Bite is a free 30-day trial of oral appliance therapy. During this offer, you can deliver a patient a myTAP trial device during the OSA diagnosis review, which is, by doing that, you give the patient a chance to feel immediate benefits with the myTAP trial device. Using an HST with the myTAP proves efficacy prior to the custom appliance being delivered or fabricated. Also, using a myTAP with an efficacy test allows you to identify non-responders. So you don't have to take a chance at making a custom appliance, finding out that maybe a custom appliance won't work for that patient. The biggest benefit, or I would say feature for our program, is that every time that you order a titration test or an efficacy test, you actually have the ability to redeem a myTAP appliance that's covered under our program. So this basically gives you the ability to offer that free 30-day trial to your patient without having to pay for a myTAP appliance. So it really gives you that ability to offer a free 30-day trial of oral appliance therapy, or what we call the Love at First Bite offer, to your patients without the financial risk of paying for a temporary appliance. In addition to this, our program includes customized questionnaires, patient brochures, access to our Easy Sleep Academy, myTAP training video, an extended version of what you saw that Dr. Patel created today, and some other discounts and benefits with our partners. So in short, that's just a quick version of what is our patient efficacy program. If you want more details, you can call us or send an email. There's information on this slide here that you see, which I think you can download from the webinar. With that said, I'd like to hand this presentation back to Steve, and I think he has some Q&A for you. Thank you.
Well, thank you, Keith, and thank you, Mayer. That was excellent. Now, I've loved the myTAP in my practice. I use it a lot. I did have a couple of questions for you, though, Mayer. And I tell you, for a patient that's brand new and thinking about oral appliance therapy, that Love at First Bite program looks great to give them a chance to say, hey, you can do this for free. And that's wonderful. But in your regular practice, where you might not need a sleep test, for example, which is, a lot of our attendees might have patients in their practice that have been diagnosed. They don't really need another sleep test, but what they want to do is get rid of their CPAP. Do you use that? Tell us about how you use that myTAP for that, and how you talk to them about that.
Yeah, so an example would be a patient that may say that, hey, I understand that you do oral appliances. I'm having difficulties with my CPAP, but I'm just not too sure if it's going to work for me. And this is a situation where we would have a discussion, demonstrate the myTAP, show them what it kind of looks like. A lot of times they have no idea of how little it is. And the idea here is to have them go home with it for at least 2 to 3 weeks. And what we ask them to do is, look, we'll adapt it, go home for 2 to 3 weeks, see what you think about it. If you get the benefits you're looking for, the biggest benefit most of them have really is the bed partner being happy. but the other might just be them themselves as far as fatigue is concerned. And we make sure that they understand that it's not going to be completely comfortable. It is pretty comfortable for the most part because it's nicely adapted and it doesn't take up much tongue space. But look for the metrics. Are you snoring? And how do you feel in the morning? If those two things are addressed, then more than likely a custom device is definitely going to be a good fit for you. The other advantage of the myTAP, as compared to other Boyle and Bites, is it's adjustable. So we instruct them that not only do you wear it based on what we set it, but you continue to advance it if you're still having difficulties in not addressing your chief complaints. And this way, we will also know when they come in roughly where this jaw needs to be for them to get some significant improvements in the symptoms. So that's basically what the discussion will play out as. And there again, it's those that are just very query about whether it's going to help them or not help them.
Cool. A question came in from the attendees, and actually that leads right into a good thing for Keith to address. And that is the protocol here is a patient is identified at risk. Then Keith, do you send them home with a easy sleep home sleep test first, and then the myTAP, and then an efficacy like another sleep test like was on the page there? Help us with the initial diagnosis. Do they need to get a PSG first? What kind of imaging do you recommend to you, Dr. Patel? What do you recommend imaging? That's the question from the attendee.
So I'll try to answer the question if I can. So we have board-certified sleep physicians in all 50 states. So if a patient has a risk for sleep apnea, then the doctor or dentist can screen for that sleep apnea and refer the patient to us to make the diagnosis. That is something they can do. And then if the patient is diagnosed with sleep apnea, particularly, let's say, mild or moderate, then in many cases, they may want to use the myTAP appliance as that trial appliance, let's say, to get the patient temporary treatment or trial treatment. And then at that point, they would maybe, then make a custom appliance. So that's one scenario where we would do a baseline test to make the diagnosis for sleep apnea. And then we would, once we provided the diagnosis, then we would do a follow-up efficacy sleep test to prove that the patient is efficacious with either the trial or the custom appliance, either way. So we can provide both tests. They could also use a sleep lab if they want for that matter, with the product, they could use it for the baseline or the follow-up testing. But we provide both versions of the test.
Well, that sounds convenient.
And the other part of the question was, as far as imaging, typically you want to get imaging to make sure the dentition's healthy, whether it be a FMX or a Panorex, depending on how your practice is set up. If you happen to have cone beam, I'm making the assumption that you're using it to look at the dentition, but you also have the opportunity at that point to look at the upper airway, get a sense if the nasal passages are clear, patent, there's no issues with it, but not always required. But at least imaging to verify that the teeth are healthy is at least bare minimum.
And let me add one more thing. The reason why we developed this Love at First Bite program is if the client is on our program, they use us for a baseline test. When they do their efficacy test, that's when they would redeem their free myTAP, so to speak, or they would redeem this myTAP that they're basically delivering to the patient. So that is the purpose of this special program that we have. So they would actually not, in a sense, be paying for this myTAP, if you will, that's being delivered to the patient. The Love at First Bite offer gives the patient that free myTAP, if you will, appliance.
Well, Keith, when you said redeem, I pictured having to send the myTAP in to get it as a kind of a coupon. That's not how it works. They get to keep the myTAP, right?
Yes, of course. Yeah, no, of course.
Hey, another question for you is, of all the temporary appliances out there, and I know a patient can go on the internet and see a ton of different choices, and we have a lot of choices as professionals as well. Why did you choose the myTAP, each of you?
I'll let you answer first, Dr. Patel.
Yeah, so the one advantage of the myTAP that we've had over some of the other devices is the ease of titration. The good thing with it is with that little protruding element, it's very easy to titrate from a bed partner's perspective or a patient's perspective. The other thing is the thinness of the device. It is very thin to the point that it adapts really well on the teeth, taking away or excluding any excessive material that one might need to take a preformed tray and getting it to fit on someone's mouth to then be able to see whether it's working or not working for the individual. So my take is the comfort from the size of fitting and definitely the protruding element where it's easy to titrate the device.
Both of those reasons are part of the reasons that we chose the product as well. We've used other products in the past. A couple additional reasons why we partnered with Airway Management, who owns the product, is number one is one size fits all. That's very easy for our client base. Another reason is that it, again, reinforced this. It is slim, it's comfortable, in some cases too comfortable. I think if the dentist doesn't set the expectation right with the patient, sometimes that could be an issue, but it's very, very comfortable, very lightweight material. Another benefit is that if, for whatever reason, if when you're fitting the product, if it doesn't fit 100% perfect, you can reuse the material, put it again in the hot water, and you can reshape the material. That's something that's very unique about the product. So that's another reason that we picked it. And I would say it's the #1 product on the market, and that's for good reasons. So that's some of the reasons that we chose this product to partner with.
It's like our patients in our practices, we're going to be presenting these things that we want them to do. And if we use real high quality partners with this, whether it be a material or a service, then that's going to bode well for the overall treatment, I think. Yeah. I use a lot of myTAPs in my practice. And one of the things I want to emphasize, I know, Mayor, you said this a few times, but for our attendees, it's boiling water is what makes the difference. That kettle that you plug in or make it boiling, that makes it super easy to fit. That's what brings it back to normal shape if you folded it or want to refit it real quick. And it's boiling water, not hot water, but boiling water. And I think that's a key thing there. Yeah. All right, here's another question that came in. As your patients affirms improvement in efficacy by wearing the Easy Sleep appliance, is there a distinction we should know when we name the subsequent long-term appliance as a mandibular advancement or a mandibular protruding device? Is it just words? Mayor, what do you think about what do we call these devices? Because we have this temporary label, for example, on myTAP, and temporary, interim, trial. Talk about how you communicate with your patients best for laying the groundwork for the optimum.
So basically, the idea is to let the patients know that this is just a device meant to just last for just no more than a few weeks is what we kind of pose to them. I've seen it as old as 6 months in some individuals, but the idea is for them not to basically think that this is the device that they're going to be finishing off in, or this is the device that if it feels great, all the other good things that all the other parameters have been addressed, there's no reason for me to invest in a custom device. So the idea here is it's a temporary device just to give us some idea whether the therapy is going to be of any value to you. But the other advantage is that when you get this device to the point that you are feeling beneficial, many times I will actually just mimic that position of the upper and lower jaw and send that off as a bite registration, which means that when the custom device gets manufactured, you already kind of done most of the guesswork as far as where this jaw needs to approximate. We, of course, to keep it lay, we say that the devices are mandibular advancement or lower jaw pulling forward appliances. But mandibular advancement devices would be probably the appropriate phrase for it since it is advancing the mandible more than anything else. I hope that answers it.
Okay. Keith, talk about marketing the love at first bite to our patients. What kind of comes with that? Because we have these devices, we have a shelf with myTAPs on them, but what's the best way, or what do you provide from Easy Sleep that lets the dentist get the word out? I see a poster behind you, for example.
Yeah, well, actually, part of our program is you get a marketing kit, a screening kit that comes with brochures, marketing materials, basically everything that you need, if you will, sort of a mini business in a box on how this program works. And even to add on a little bit to what Dr. Patel was saying on how we word or how we sort of script how the temporary or trial device fits, at least this myTAP and Love at First Bite, we try to package this together as a 30-day trial that goes along with our efficacy home sleep test so that the patient has a tangible timeline on when they need to go ahead and basically do their follow-up testing and their trial. Now, not every time can a patient be titrated within 30 days. So that 30-day mark can be flexible, but we try to assist the doctors in coming up with these timelines and the scripting and basically the marketing materials that create this love at first bite and that offer. So really what this is about for the patient, the consumer marketing end of it, is offering your patient that chance, that love at first bite, and having everything take place in that 30-day period. So in short, that is what love at first bite is, and sort of what our marketing program is that goes around that.
Yeah, so not a lot of burden for the staff in the office to add into a busy practice, and yet it also doesn't stretch out forever either. There's kind of an endpoint to this, and so it can be a system that can be put in place.
Correct. We already have a system in place where we make it very simple, very easy, for the practice to implement this.
Right. Hey, Mayor, I thought of something else too. One of the things I find with the myTAP is that I reach in there and I make sure that I look for little bubbles of the thermocryl material that might lift up or interfere with when the patients bite together or they move around. And sometimes that happens only on one side. And if it happens on one side, that gives you that imbalance. And patients will come back and say, oh, that my right side hurts. And you look in there and there's a little stone in the way almost. So we look at that too. So,
good point. Good point.
Yeah, I use so many of these. It's exciting. Okay. Sorry.
And the good thing is, it's so easy to adapt. If you make a mistake, it's not like you have to purchase another kit. Just hot boiling water, and you're right back to ground zero.
So, a question from the participants: when using the myTAP, we allow the patients to wear it at home for a few weeks, and they kind of titrate it subjectively, like you said, with a bed partner sometimes even, and before we then schedule the HST. So it's not like, the night one, or is it? Could you walk us through that timeline again, please?
Yeah. So, the whole idea is once the device has been fitted, the patient's instructed, and some people may use a weekly protocol or every 2 to 3 days. There's no really rule to this. But what you tell the patient is, look, wear the device, get used to it, give yourself 2 to 3 days, and take the average of how you felt. If you felt that the snoring has improved, then leave it where it's at. If you feel that the snoring has improved, but there's still some snoring, then I want you to continue to advance this device. On the other hand, you wear this device and everything feels great. Don't even turn it. Just leave it the way it is. Okay. The idea for turning it is to gradually move the jaw forward to try and impact the upper airway. And the idea is to find that position that actually gives them their relief or the changes in their symptoms. So every week, turn it. Every 3 to 4 days, turn it, but turn it to the point of subjective improvement. Because the first part is just to get to the point where they feel that they're feeling better, or there's feedback from the bed partner that they're not gasping or snoring. After that, objective testing would be done with some home test device to validate that the apnea or the underlying medically diagnosed condition has been addressed. So yes, advancing it does take a good couple of weeks, depending how bad the individual is or how much the jaw needs to be moved. But that is part of the whole process of figuring out whether the device is going to work or not work.
Okay. And somebody brought in a question about what you said a minute ago. If they find that position where it works or it doesn't work, and so presumably it works, talk about how you transfer that position into the lab for the custom device. Now you've
So there's a couple ways. Yeah, I know. So it's a loaded question depending on how you're going to look at this. So let's put it this way. If you know roughly where the jaw needs to go, and you've got that based on the myTAP, and you know where it kind of holds the jaw, I may just mimic that position using another bite registration material, whether it be a George gauge or whatever you might want to use in your office to determine where the jaw should be. On a few instances, just a few, I was able to send the myTAP to the laboratory, have the laboratory mount your models, send me back the myTAP so I can give it back to the patient, and then they would proceed with fabricating the device. But what the myTAP did for me is gave me that position that the upper and lower jaw needs to be in. So that could be another way to pull this off. What you find is difficult is patients won't let it go. So you have to be creative and try and capture that bite, or mounting it in the office and then giving them back the myTAP and then send the mounted models off to the laboratory for fabrication. Okay.
So it's just dentists being creative to meet the patient's needs and also the lab needs. That's kind of the fun. And that actually, I think, is one of the great reasons why to use it. Another great reason to use a myTAP is we get to be responsive right away to our patients. And along with that, gosh, when we talk to a patient about sleep stuff and they say, well, what do I have to do? And we can offer them a home sleep test that's read by a board-certified sleep physician, as easy as it is to work with Easy Sleep, versus having to be sent to the sleep lab. Isn't that much better?
Oh, for sure.
You know?
For sure.
Yeah. All right, Keith, anything else you'd like to add to our webinar tonight?
No, I think we're good. Thank you both for taking the time to have this webinar with us.
Yeah, I think this is a really valuable service here. Mayor, your last words here.
Well, I want to thank everybody. I do want to tell everybody, do get involved in dental sleep medicine. There's a lot to be done in the future as far as this is concerned. We have just basically touched the infancy. Easy Sleep is a great resource as far as testing is concerned, which is one of the major concerns many individuals have as far as getting patients diagnosed. And I would also thank you, Steve, for all the effort that you place with dental sleep practice and all the other ventures you do in getting this information out to the dental community. So I want to thank all of you that participated today.
Well, thanks a lot. And there's a handout there on your on the side of your screen right there that has the Easy Sleep offer. So get in contact with Easy Sleep, and they'll walk you through all your different choices. So I want to thank Easy Sleep for sponsoring this webinar, Mayor for bringing us more of the good information you bring in every time somebody's lucky enough to hear you speak. And then thank you on behalf of Dental Sleep Practice Magazine. And I hope you guys have a good evening. And thank you. And we're done. Good night.
Thank you very much.